This video is for educational purposes only. The purpose of this video is to demonstrate the preparation and administration of subcutaneous unfractionated heparin injections. It is produced for the use of educating primary healthcare workers. Unfractionated heparin is one of the anticoagulants used for thromboprophylaxis amongst antenatal and postpartum women with a body weight between 50 and 90 kilograms. The dose of the subcutaneous heparin injection is 5,000 international units twice daily, i.e. 12 hours apart. Please refer to your local guidelines or protocols on venous thromboprophylaxis for the indication of subcutaneous heparin injections. Kindly follow standard operating procedures for the administration of this medication in your center. Calculation of the dose. The heparin formulation that is commonly used is heparinol 5,000 international units per ml, which contains 5 ml in a vial. As the dosage of subcutaneous heparin commonly used is 5,000 international units, therefore 1 ml is needed. Please note that the formulation of heparin in your center may differ from the formulation used in this video. Should this be the case, please contact your doctor for the correct calculation of the dose. Counter-checking medication with colleagues and patients. In an effort to minimize the risk of error in medications, it is very important to have a colleague to counter-check the drug preparation according to standard operating procedures. First, the patient's identity, name and identification number should be checked. Next, the dosage of heparin and correct medication should be confirmed. You also need to confirm the patient's identity with the patient herself. Withdrawing the heparin. Preparation and administration of heparin should be done using aseptic techniques. To withdraw the heparin, first open the cap of the vial and clean the top of the vial with an alcohol swab. Next, attach a 21 gauge or 23 gauge needle to a 1 cc syringe. Withdraw 1 cc of air, which will be injected into the heparin vial later. This is to facilitate the withdrawal of heparin from the vial. Now, insert the needle perpendicularly into the vial via the rubber bung. Inject the air that was withdrawn earlier, and then draw out 1 cc of heparin into the syringe. Withdraw the needle and syringe from the vial. Expel the air within the syringe and ensure that the dose is accurate. Confirm the dose with your colleague. Next, change the needle to a smaller needle, which is either a 25 gauge or 26 gauge needle, and fill the needle with heparin. Remember to dispose of the first needle accordingly. The remainder of the heparin within the vial can be used for up to 28 days following the first withdrawal. Please do not refrigerate the vial after opening. And now, you are ready to administer the medication. Administering the heparin. Explain to the patient that you are about to give her the heparin injection as ordered by her attending doctor. Remember to ask her about any history of drug allergies before giving the injection. First, expose the site of the injection. The recommended site for the injection is into the subcutaneous layer of the abdomen. The area of injection should be at least 5 cm away from the umbilicus circumferentially and above the iliac crest. Alternatively, subcutaneous injections can be given into the fatty layer of the thigh. Beware that heparin should not be injected into muscle. Put on a pair of sterile gloves. Clean the site of injection with an alcohol swab and let it air dry. Uncap the needle. Pinch a fold of skin with your thumb and forefinger. This fold must be maintained throughout the injection. Next, insert the needle at 90 degrees into the skin fold. Administer the heparin by pressing the plunger with your thumb until the syringe is empty. Then, withdraw the needle and dispose it into the shut bin. Check the area of injection for any signs of active bleeding. It is preferable to have different areas for each injection. Lastly, advise your patient to watch out for the side effects of the heparin injection, which include bruising at the site of the injection, wound hematoma, and rarely, allergic reaction with skin necrosis. Thrombocytopenia is also a possible complication from heparin injections. Therefore, the patient should be informed to have a full blood count checked during the course of the heparin treatment. For further information, kindly contact your doctor from your clinic or from the nearest hospital. Thank you for watching.